Hey everybody, this is Troy Alexander Inspiration. We're Troy Alexander one more time. We are excited tonight to be back. Tonight we have an amazing guest and we're excited tonight because so much. We got a thumbs up from the producer. We are so excited tonight about this broadcast tonight. And listen, you know what our motto is: dream, take that step, and walk with purpose into your destiny. Listen, every week we come on here to encourage you to never give up on your dream, to hold on to your dream and know that you have purpose and to walk in it. Listen, stay connected with us on Facebook as well. Facebook, Troy Alexander. We're on Instagram. I love taking pictures. Follow us at Pick by Design, at Pick by Design. We're on YouTube, Inspiration with Troy Alexander. And we have our nonprofit, Call to Inspire Incorporated. Follow us at calltoinspire.org. Tonight, we have an amazing young lady tonight. I'm so excited and honored to have her as an amazing guest. Right now, listen, she is Miss Monmouth County 2020-2021 International United Miss. Listen, she is a registered nurse. She has studied abroad in Costa Rica doing missionary nursing. My goodness, she's an advocate for mental health, substance abuse, chronic invisible illnesses. Listen, she is a double tissue transplantee where she underwent bilateral hip surgery. A leader of the Jersey Shore Daisy Level Girl Scout Troop. Listen, that's not it, y'all. Member of the Monmouth County Medical Reserve Corps and founder of Kris Kaps, mission to inspire others struggling with hair loss to still feel confident. Welcome, Tina MIANO. How are you tonight, Tina?
I'm good. Thank you for having me, Troy.
Oh, it's such an honor to have you. And I'm telling you, everybody, she is so amazing and so phenomenal tonight. So, Tina, I got to ask you, first of all, why did you desire to get into nursing?
I've been sick my whole life, pretty much from an adolescence, and it was always the nurses that listened to me. My mom was a nurse, so I grew up around a nurse, and I saw how she treated her patients, and I wanted to be able to impact the lives of others the same way that she did. And then obviously being sick myself and seeing that the nurses were the ones who advocated for the patients greatly, it really wanted me to be able to help others the way people have helped me.
Wonderful. That is awesome and inspiring. And of course, I got to ask you so much as we go more into the interview. I want to know, like, how do you stay so confident and positive, but not just yet. I got to ask you because, listen, I understand that you made the dean's list. Now, listen, everybody don't make the dean's list. Was that an aspiration of yours, or did that just evolve?
It sure was. I struggled a lot throughout high school because of my medical challenges and wasn't able to attend the last 2 years of school. I was homeschooled, so I didn't really have the same opportunities. So I made it a mission of mine to work hard and study hard and to try to make the dean's list. And I did with a 3.865. And I'll never forget that. I was very proud. And it was one of my first semesters of nursing school as well.
Wonderful. That is so amazing. We're so proud of you. I mean, all of what you've done and even what's to come, Tina. We're so excited. And listen, I want to go right into, because you just said it. Like, what was that like to not be able to finish your last 2 years of high school? Because I can only imagine, but just share with us what that experience was like.
It was pretty rough, especially at the age that I was at. A lot of kids my age and adolescents at that age don't really understand what other people are going through when they become homebound. And while I had siblings, it's just not the same to not see your peers every day or to not have people checking in or asking how you are, just because they don't really understand the medical challenges that you might be facing. So I obviously was homeschooled for the last 2 years of high school. I underwent hip surgery a week before graduation and decided to walk across stage without my crutches because I had finally graduated on time with the rest of my kids in my year, and I had no issues. And then of course I grabbed my crutches right as I got off the stage, but that was a goal of mine, and I did it. I wasn't delayed and I still graduated on time. So I mean, I give myself a lot of credit for studying while at home. It was not easy, and then undergoing bilateral hip surgery.
Wow. Now wait a minute, Tina, you're telling me that you had surgery the day before graduation?
The week before.
Oh, the week of.
The week of.
Wow.
Yeah.
And you walked across the stage.
I sure did. not with doctor's advice, but I sure did.
Oh my goodness. Listen, I can't even imagine bilateral hip. I mean, you had hip surgery.
Yes.
On both hips, right?
Yes, on both hips in 2015. It was April of 2015 and June of 2015. And then to segue into recently, I actually underwent hip surgery again this past year 3 times in January, March, and October. And obviously the latest one is the one that you know of, which ended up with me on life support. So
wow. Oh my goodness, Tina.
so in total, I've had 5 hip surgeries.
Wow. Wow. You are truly an inspiration. I mean, I can't even, there's really no words to even describe.
Well, let me give you a word. It's because of Donate Life. It's because of 2 angels in the sky that I still walk today freely on my own. So I encourage anybody and everybody to register to be an organ and tissue donor, because through organ and tissue donation, organs can save 8 lives and tissues can save up to 75 lives. And it's because of 2 people who chose to give that gift that I'm continuing to walk on my own down here today.
Wow, Tina. Wow, that is so powerful. Oh my goodness. I can't even, yes, the power of donating, right? Your tissue, donating your organs will
everything.
Save.
It's all useful. There is no contraindications with any religion. There's nothing with it anymore. No matter what disease you have, HIV or AIDS, anything, having had cancer, anything, it's all completely okay to be able to be a organ and tissue donor. So
wow, you have just inspired the world, Tina. I mean, so many people, and I've heard people talk about that before, right? I've talked to them, but just hearing you say it in the way that you said it, oh my goodness, I can only imagine how many more people are going to now say, you know what, I want to donate my organs, my tissue, because, and you said it'll save 8 lives?
8 lives via organs. So one donor, one deceased person can save 8 lives via organs and 75 through tissues and ligaments. And it's really easy to do. You just go on to the state website that you live in. So let's just say New Jersey, you'd go on to the New Jersey DMV, you type in your license number and you can register there. You can register in person at the DMV. It's super easy. All you need is your license number. And that's how you can become a registered donor. It does not mean that you won't receive medical care or treatment or attention in the time of an emergency. It just means that should something happen and the time comes, God willing, you would be able to be a donor.
Tina, how have you maintained? Because I see you now. You have this amazing smile, this beautiful disposition. I would have never known, with you having all the hip surgeries that you've had and all the other, I would have never known. What has helped you to just...
I attribute it a lot to my strength and determination and want to do more in life. I feel like if you just sulk in whatever you're given, and I've been given a lot, that you won't make it very far. And I am very proud of myself with what I've been given and what I've done with it. And I truly believe that that's what it's about. You got to take what you're given, the good with the bad, and smile when you're sad. And I really honestly use that animosity, and instead of taking it out on other people or taking it out on the world, I take it out in strength and determination and go on further to do other things. So I used like that anger inside me to fuel some other passions.
Listen, everybody, I hope you have a chance to meet Tina one day, because she will make you smile. She will uplift. If you're sad, she'll just an amazing person, I'm just so proud of you, Tina. So proud of you. So I got to ask you now, because listen, you talked about not being able to attend your prom, but you said you're going to take that same dress and turn it around and use it in pageantry.
Yes. I mean, so I had a dress and I was like, well, what am I going to do with this? And instead of just being like, well, I'm not going to go to prom and just throw it out or give it away, I said, well, what else can I do to make it like a mini prom, or in some way have some sort of experience? And not many people do pageants at that time that I was familiar with. So I was like, well, this is a chance for me to use the dress. And my mom and I were like, just one pageant, that's it. And, you know, obviously the rest is history because I've still been competing. But it fueled a whole nother passion of mine. And so I'm thankful that that was the road that was supposed to be taken. And I really, truly do feel that that was what was supposed to be. Like, that was just meant to be, and that's how it was going to be. And I'm happy with it.
Wow. Well, listen, all I can say is beautiful. And I got to ask you, how long was it between your prom from when you decided to do your first pageant?
It was that summer. I believe it was July or August. So about 2 or 3 months.
Wait a minute, Tina. Wait. So you're telling me after all of the surgeries, after being homeschooled for 2 years, the week of, graduation, then you're walking across the stage really quickly or at some pace, getting back on your crutches. And then that same year, you go into pageantry?
Yes, sir.
What was it that inspired you to even do that?
Well, I figured I never had that same opportunity that other girls my age had to shine. And although it wasn't going to be in the same aspect, it was in the same like region per se. So that was pretty much it. I figured, why pretend like it never happened and just forget about the dress? Why not just, have like a mini version of it? And I mean, no, it wasn't the same. But like I said, it fueled another passion. And I think, things are just meant to be, and things are meant to work out in mysterious ways. And God works in mysterious ways. And I just think that was truly what was supposed to happen. I feel like everything in everybody's life happens for a reason. And I feel that he put me through that and he gave me another opportunity. And for that, I'm blessed.
Tina, wait. Now you have to like explain to us now, have you always been so positive, or did that evolve?
I would like to say that I've always been positive, but I had a very rough childhood. And if it wasn't for remaining positive, I don't think that I would have come so far. And I really do feel that if you don't remain positive, it's not going to help anybody else. And it's certainly not going to help yourself. And nobody's going to help you if you're always, not positive, or always down, or always angry with everybody who didn't cause it or can't cure it either. So I would say I've always been a pretty positive person.
Well, you are. I mean, you are a shining light of inspiration.
Thank you.
And I'm so proud to know you. And listen, y'all, we'll tell you how that happened a little bit later. But I want to ask you about your missionary nursing. You went to Costa Rica?
Yes.
Yes.
In my senior year of college, it was going into my senior year of college, they had an opportunity for you to sign up to study abroad in Costa Rica. And little did I know at the time what it meant, but I'm, again, absolutely glad that I went and honored to have done so. So I went to a third world country known as Costa Rica. I was on the outskirts in San Pablo, and I worked and made clinics in the field. So obviously, it's definitely not like the States. These people live on sand and dirt roads, and they build shacks out of tarps and wood. They don't really have clothes. So what we did was we collected medications here in the United States that were expired, and we brought them to Costa Rica, and we set up little medical clinics in the fields in their communities, and we'd have them come through us. I learned Spanish within a week, and we'd ask them for like their social security number, their name, what health conditions they've been diagnosed with, and then we would treat them really just minimally with what we had. So we would give them like a few blood pressure medications and explain to them the symptoms of what high blood pressure is, and to take one when you're experiencing those symptoms, obviously, because we only had so much to give them. But we were able to provide a lot of education, preventative medication, and really just spread awareness regarding diseases that are very common there, because they're not so aware of hand hygiene and food preparation. So for about 12 days, I was in a field with them. I lived in a convent, and I worked with the population for health promotion.
Amazing.
Prevention.
Amazing. So proud of you, Tina. I'm just so proud of who you are and who you're becoming. It's so amazing and phenomenal. And to know her in person, I can't even tell you how amazing that is, right? So
thank you.
So listen, no, absolutely. So I got to ask you, listen, you advocate for so many causes. I mean, from substance abuse, mental health.
Yes, sir.
Chronic invisible. Why do you advocate so much?
Well, I truly do feel that I was given these things for a reason. And throughout my life experiences, I feel that sharing my journey through them all has, even if it has helped one person in one aspect, it has certainly changed other people's lives and has provided some sort of education or awareness. So I feel like it's my job, and I enjoy doing it. And if it was all to help one person, I think it was worth it. Obviously, I advocate greatly for chronic and invisible illnesses because I have quite a few. I advocate greatly for mental health because of all that I've been through. As anyone can imagine, it has caused a lot of emotional and mental stress. And then I advocate greatly for substance and alcohol abuse because I was raised around an abusive alcoholic. And so I want other children to know that there's other people out there who have made it further, regardless of how they were treated, if they were abused, spoken down to. And I just feel like it's my duty truly to be able to spread that awareness. and show others that there are people out there like them that have still gone on and just inspired others and moved on with their lives.
Amazing, amazing. So proud of you, Tina. So proud of you and who you are. And I'm telling you, so much more in store for your life. So
I hope so.
Tina, I tell you, without a doubt, it is. Without a doubt, it is. I can't even begin to tell you how many doors that you haven't seen are going to open. And it's so amazing. And we're so proud of you tonight. But listen, I got to ask you, you talked about why do you think it's so important to share your story?
Because I feel like other people need to know that there's still people out there who are going on with their lives, regardless of what they may be going through, who are not letting it stop them, define them, making them feel less than, or making them feel like they're not going to have the same opportunities that others have. And that's like my biggest thing. I want people to know that regardless of what you're going through in any aspect of life, that you can still have the same opportunities as everybody else. You just might have to put in a little bit more effort, but I promise it's going to be worth it.
Absolutely. And then you said, you know what? I'm not going to stop there. I'm going to go on and become a leader of the Jersey Shore Daisy Level Girl Scouts.
Yes, sir.
What do you hope that the young ladies would see in you?
I hope that I can inspire them to do better, be better, include others, and make the world a better place by being a sister to every scout. I was a Girl Scout growing up my whole life, and it was part of what shaped me into who I am today. I would give the shirt off of my back to anybody, regardless of how they treated me in the past or what they've done. And I want other girls to learn those life skills, and I want them to learn all the things that I've learned. And I hope that it just shapes them into the person that they are, and that they remember who I was and what I might have taught them, even if it was just one thing. So I just would like to shape their little minds.
Absolutely. Well, you are doing that because in just a short time that I've known you, I mean, you have such a light about you. You have such an inspiration, a joy about you that is so amazing. And I'm so proud to know you. And so listen, I got to ask you about Kris's Kaps.
Yes.
Please tell us more about that.
So if it's not obvious, I obviously have no hair. I lost all my hair in January. I've been losing my hair for about 6 years now. I'll give you a brief recap. I started losing my hair when I was about 14 or 15. It was shedding and thinning. They were attributed to stress. And then after a while, it was coming out in clumps and falling out in the shower. They finally diagnosed me with something known as PCOS, which is polycystic ovarian syndrome. And they attributed the hair to something called androgenic alopecia. It's a form of alopecia in women, which means that their androgen levels are very high. So over the course of the last 4 years, my hair has obviously gotten very thin, patchy, and has fallen out. This past January, I had to shave whatever was left because in October, when I was on life support, they had something known as an EEG on my head. And from all the electrodes and everything, once they removed that, I pretty much lost any little bit that I had. So this past January, I lost all of my hair. And I've never felt more free in my life, but I won't lie, it's not come without its challenges emotionally and mentally. But I, again, feel that it was just part of the journey. It's just another story in the chapter book. And if I have hair one day again, that's great. And if not, it was a pleasure to have it. And it's an honor to be bald now.
Yes. Well, it's an honor to just see the beauty in you. And I can only imagine, yes. And I can only imagine how many young people or even people of all ages are watching you, hearing you, and seeing the great inspiration that you are, stepping out in your greatness even the more, regardless of everything that you've been through. And I can only imagine what the emotional strength that it took to get to this point. And so all I can say is thank you. Thank you so much for being willing to step out into something greater. And so I got to ask you, because you have this statement in your bio that says, I want to inspire others, that anything is possible regardless of your circumstances. You just have to believe. How did you get to that place?
So growing up, my mom always told me to believe. I actually have her handwriting tattooed on my wrist with her word that said believe. She always told me to keep the faith, that you just have to believe, that you have to believe it's going to work out. You just have to believe in the Lord. You just have to believe. And I mean, as know, it sounds very cliche and people don't want to hear the motivational sap. But I really do think that it's a great word. And I think it's very true, because if you don't believe, then, you know, what are you living for? Things don't happen overnight. And I really, truly do believe that I've been put through everything I am for a reason. And while I may not know it, or I may know it, it doesn't make a difference in my life, because I just believe that this is what was supposed to happen and this is what was supposed to be. And I'm where I'm meant to be because I believed, and I'm okay with that. So that's where that word believe comes in. And just back to the Kris's Kaps. So since I've lost all my hair, I've made it a mission quarterly to collect wigs, chemo caps, turbans, silk wraps, and then I donate them to a chemo and hematological facility, a treatment facility quarterly, for women who might be suffering with self-confidence, with a cold head, who can't afford it or who want to try it. So that's what I do. So the last one I actually donated to Staten Island University Hospital, which is actually where I underwent hematology treatments. And then my latest donation was to a dialysis facility for some patients there. So I collect all different sorts of head care items for people who might be going through that.
Wow. Wow. All I can say, Tina, is you are an inspiration.
Thank you.
In my eyes, you're an angel, because
you.
I don't know who else could have come through everything that you've experienced and continue to go through and still have the power to believe and smile. Listen, everybody, when you see her smile in person, it lights up the world. I mean, one of the most beautiful. So listen, look at her picture. So we'll go to there in just a moment. But I'm telling you, you are such an inspiration. And I love how you press through things and you don't give up, but you use the moments to inspire others in whatever it is. And so can people help to donate to Kris's Kaps or to all that you're doing?
Yes, absolutely. Anything I have an Amazon wish list going. They could choose something from there and send it to me. And then I collect them and obviously donate them. Or if they have old scarves, old hats, baseball caps, if they happen to have gone through any chemo or hemo treatments and have any old stuff there, any wigs, I'd be happy to collect them and put together my next donation and choose a facility. I could also take recommendations on facilities that people may have treated at or think of that might be a need, and I'd be willing to coordinate with the social worker there as well.
Phenomenal. Listen, you have to send me the Amazon link.
Yes, okay? I will.
Yes, because I'm telling you right now, I have been so inspired. I have been so moved, and I'll tell you how after the show, but so amazing and powerful that I can't even really have words. Listen, I mean, you've done so much. What's next for you? What's on Tina's vision board next?
So my next goal in life would be to earn my doctorate in nursing practice and work in a ICU as a DNP. Aside from that, my goal in life is to just continue to do what I've been doing and change the lives of others, to continue to share my word and my story. And I know that some people won't like it, or some people might think, enough's enough. But I just believe this is my word and this is what I have to live by. And I wouldn't be going through it if it wasn't for a reason. And I feel it's my need to share it. So I always say you could follow along, you could like, subscribe, share, comment, but you can also scroll right past it. So if you need it and you see it, then that's all I need.
Wow. I love it. You're such, I listen, I really don't even have the words or the dictionary or the Google to really describe your greatness and your limit. Tina, I'm telling you, and you're limitless. Listen, all of us listen, as you can probably tell, it's a little warm in the space that I'm at. So but I said, you know what? I'm not going to give up. I'm not going to not do, but I'm going to keep pressing through because it's about the message. It's about,
exactly.
Yes. And so no matter what we have to go through, there's something greater on the other side.
Yes.
So I've learned, yes. And so I've learned it may not look the best as what other people might say or present it in such a way, but just one word, Tina, I've seen where one word has changed people's lives. And so I'm just in awe of you. So I have to ask you again, you will become that doctor, you received that PhD, you will, no limit. If you want to get a Nobel Prize, Tina, I wouldn't be surprised if I see you on television.
You will be front row.
Oh, thank you so much. But listen, I have to say, is what more can I say? I listen. I had these questions, and I said, listen, you've answered so much of who you are, where you're going, how you've gotten here. Have you ever been down? Have you ever got to a point where you wasn't sure of how you would make it through, or you would just been?
Oh, absolutely. So, when I graduated high school, I went right away to a 4-year baccalaureate institution, and I obviously earned my bachelor's degree of science in nursing. And I went away to school sick, and I had no idea how I was going to do it. I said to my mom, like, it's not fair. I'm not going to have the same opportunities, not even so much academically, but socially. I was like, no one's going to want to hang out with somebody who's sick. No one's going to want to hang out with somebody who can't drink, or regardless if it's for personal reasons or medical reasons. No one's going to hang out with somebody who's going bald, or, who's thick and fat because they're overweight from a medical condition, or they think you're gross, or whatever it is. Who's going to want to hang out with somebody that has to take 16 injections and, 15 pills and has to go home for blood work, or needs a companion to go to get an x-ray. And it was rough, but I feel that God puts people in your life for a reason, whether it's just for a season or for your life. And I'm lucky to have met some amazing people when I was away at school, at college, and they're still with me today. And I feel that, people come into your life, and some will stay and some will go, but the door's open. And I'm lucky for the ones that have stayed and who were my rock through it all. And I really do feel that it's because of them that I made it through. It was very rough. It wasn't easy. Anybody has it easy. And then obviously with some medical challenges, it made it just that much easier. It was even difficult, going to clinical as clinical rotation, going on the unit, being sick. And the night before I was at the hospital myself. But I just, put on that uniform and went and wiped my stuff away and was there for my patients. So I attributed a lot to the people that stood beside me. And I always say that I have the best cheerleaders behind me, and I wouldn't be standing here today if it wasn't for them.
I don't know what else to say. Listen, everybody, and I'm going to tell you how we met, right? I put out a flyer, right? Just, asking for people if they have new ideas, things that they want to shoot, right? I was looking for people that had ideas, locations, right? Concepts to photo shoot. And so nobody responded. I think it was out there for about maybe like a month and a half. I think maybe a month and a half, maybe. Nobody responded. Then all of a sudden I get this message from Tina. Never have met her, never connected, never. I'm like, okay. So I'm trying to see who she, and so we connected, met her the first, maybe 3 weeks ago?
3 weeks ago. Feels like a lifetime.
It does, Tina, it does. We met 3 weeks ago, and an amazing mom as well. Her mother is, oh man, Miss Joanne, she's amazing as well. So met them both. And I don't know what it was. It was just an instant. I saw like this, like this light. She got out the vehicle. I was like, what? Just and her spirit is so, and because even more, see, what I love about you, Tina, is that the beauty is in you as well. And I think what people have to realize is that that's really what makes a person truly beautiful, is their spirit. It's their joy, it's their belief, it's their, not that physical, but it's what's on the inside. And if I have to say it, you have both. So
thank you so much. I appreciate it.
Absolutely. And so it's been an honor to do these photo shoots with you. And
it's been a pleasure to work with you. And I appreciate all the opportunities and the beautiful work that you do. It's really been a pleasure.
Well, I thank you.
I mean, I'll tell you and everybody else, when I needed to get headshots, I struggled finding a photographer. And I won't lie, I messaged a lot. I made a post saying that I needed photographers. And I was a little appalled and taken back, but then I respected them and was appreciative of their, being so open about it and not lying and wasting each other's time. But some of them responded to me just saying, like, I don't work with bald people. And it just really made me feel like I was like nothing, like I was just not a person anymore, and they just don't work with bald people. And while they attributed it to lighting or whatever, you never have downplayed my health issues or made it that we weren't able to do it because I was bald. And you've really, truly embraced who I am. So I really do appreciate that.
Absolutely. Absolutely. Well, listen, I just, I'm proud of you, and I'm in awe of you at the same time.
Thank you.
You are just such a phenomenal individual. And I want, oh, trust me, the world's going to know you. I mean, they already know a lot, but more of the world is going to know you. Listen, everybody, I told Tina she's going to be on the cover of somebody's magazine. She's going to be
from your mouth to God's ears.
I'm telling you, without a doubt, I'm just because you're that amazing. And listen,
sign the issue for you.
Well, thank you.
You got that on recording.
Listen, I'm going to tell you right now. I went to get a haircut the other day, and my barber, she said, "Troy, who is the young lady that?" I said, "That's Tina." She said, "Please tell her she's beautiful."
Oh, thank you.
Tell her she's amazing. I said, "I certainly will," not knowing I was going to tell you live on the broadcast.
Thank you. And yes. Thank you to her if she's listening.
Yes, I'm telling you, it's so phenomenal. And what I love about both you and I, we don't give up, right? We pursue, we press forward. As I said before, I've never done a broadcast, and I want to apologize, where it's, given the conditions that I have no control over, it's very warm in this space. So I'm sorry that I'm doing my brow, and
but don't you worry. You don't have to apologize.
My shirt is, but you know what? It's I'm going to keep moving forward, because so many people would say, you know what? Let's cancel the show. Let's wait until next week or the week after. But look what we have missed. If I had said, because who knows what might so I'm glad that I pressed forward. Yes, the sweat and all.
I have to tell you, when I was in October of this past year, I had emergency hip surgery. The graft of the donated tissue that I had received had emergently detached from my muscle. And so they needed to hurry up and go in and obviously tack that down. Well, unfortunately, I never woke up. I started seizing. I was foaming from the mouth. My heart rate was high. I wasn't breathing right. I was transferred to a top neurology ICU in Manhattan via ambulance, where I was ambu bagged the whole way there. And when I got there, I was intubated and put on life support, and I remained on life support. And I bring up this point because a lot of people don't realize that you're there, but you're not there. And when I was coming to it, while I had a tube down my throat, a feeding tube, I was on full ventilator support. I had pumps and lines going of Versed and propofol, which is sedative medications to calm and relax your brain and put you in a medically induced coma. And I was taking my hands out, and both as a nurse and a patient, I'm familiar with a lot of things, obviously with my experience, both personally and professionally. And I was taking my hands out to try to indicate to them that I wanted to write something while being sedated and still on a ventilator. And I wrote, and I have a picture of it. And I heard the respiratory team talking about me, and they were saying, "We cannot wean her. We cannot take her off. She's not, her lungs aren't breathing enough on their own." And I did it with my left hand. I'm not left-handed. I wrote with my non-dominant hand, and I wrote, "Do that, give me a chance." And they extubated me. My heart rate dropped, and my respiratory rate dropped to a 0. And then they said, "Take a deep breath. You got to breathe for us." And I started breathing on my own again. So I really do attribute that to a lot as well. I just think that was one of my lines now. So I feel that people just need to fight for their chance. And if you don't ask for your chance, sometimes it's not going to happen. So people should take word with your flyer, and with anything in life, you need to ask, you need to speak up, because it's not going to always be presented to you. It's not going to always be an offer. Sometimes you have to make it happen. And I don't know what would have happened if I didn't, but I'm glad that I did, and that I can share that with people today. So my whole story behind that is that you have to ask for your chance sometimes, even though life's unfair. And it has been incredibly unfair for me every time. I've still asked for my chance.
Wow. I don't know. Thank you. Thank you. Thank you for not giving up. Thank you for not giving up. I wouldn't have, to have my life even that much more blessed because you chose not to give up. Everybody who's been touched by your life are blessed because you chose not to give up. And so to encourage everybody else, do not give up on you, no matter the circumstance. And I'm so glad, even with your left hand, you did not give up.
I didn't.
I'm so
and
proud
I
of
won't lie, the recovery, obviously for a third hip surgery in 1 year and for the fifth hip surgery in 5 years, and having just been on life support and a ventilator, I won't lie, it was a very rough recovery. And during a pandemic where nobody was able to come visit me and my respiratory and immune status was wonky and I couldn't have any visitors, I can't tell you it was easy. And if I was to say it wasn't depressing, I'd be lying.
Wow.
But because of a few people, I'm still here today. And then obviously come January, I lost all my hair. So that wasn't any easier. But again, it's because of those few people who have still appreciated me being in their life, regardless of what I looked like or, had a pack with me. It's meant the whole world to me to still be included, regardless of the presence of alcohol or age or looks. It's really, truly meant the whole world to me to still be treated the same.
Wow. Wow. Well, I'm so glad that you responded to the flyer. I'm so glad that you responded.
Thank you.
And I cannot even, and I've said it to you, and I'll keep saying it to you. It's a miracle. You are a miracle. You are a miracle from God. And I just, I'm just honored to know you, and it's a blessing. And I can't wait for us to get back together again. But just so honored to know you. And I have to ask you though, do you have any physical pain like daily or often or just not?
So I do. I have quite a few chronic illnesses. I'm not sure what people are familiar with, but to sum them up, I'm just going to use acronyms, but I'd love to come back on and maybe do like a more medically in-depth show regarding my conditions. But I have PCOS, which is polycystic ovarian syndrome. I have Hashimoto's, which is a thyroid condition. I have something called supraventricular tachycardia, which is a heart rate condition, which means my heart rate just goes up and down drastically. I have reactive hypoglycemia, meaning after I eat, my blood sugar drops. I have a pituitary adenoma, which is a benign brain tumor, but does cause constant migraines and vision problems. I have metabolic syndrome, insulin resistance. I have a very long list of health conditions. And I do experience physical pain daily, and I still go to work and still participate in life because I just feel, what am I going to do? What is the alternative to that? Sitting home? What is my other option? There is no other option. I don't view me stopping my life now. I'm only 24, but in the previous years, at 21 or 22, I don't view stopping my life as a solution. So I work through a lot of it. So obviously I'm a nurse and I wouldn't change it for the world. I love my job. I love what I do. And I love being able to help others. I, again, won't lie. There are many days at work that I myself am sick, but I'm still there and I wouldn't have it any other way because those patients still need me. And I know that my nurses would do the same for me because we're like a cult. So I am in physical pain daily from my hips or any of my other medical conditions. But I power through it. I mean, I thank God for medication and science. I do feel that a lot of it has helped me greatly. And honestly, if it wasn't for it, I wouldn't be here today. I take 5 injections a month. I go for IV infusions. I take 16 pills a day. And, it's not like, vitamins, it's, medication. I have a CGM, which is a continuous glucose monitoring system. I have a lot going on, but I try to make my life as normal as possible and to be just like everybody else my age. There's just a little twist on it, but I wasn't given a choice, but I was given a chance. So thank you.
Yes, we have to bring you back, and we want to go through and have a more in-depth discussion about all that you're experiencing and the part of your journey that is now. And I'm so, so thankful that you did not give up.
Thank you.
Thankful. But just really quick, I want to ask you, how long, how long were you on life support?
It was about 2 days, just about.
Wow.
And they didn't know what the outcome was going to be because obviously you never know when somebody's intubated, how much, what could have transpired in their brain, whether it was brain damage or nerve damage, you just never know. So, I mean, obviously I'm still here today. I haven't lost any capabilities or abilities. I mean, following it, I was definitely declining from having just had surgery and then remaining in an ICU for a week and being on life support. So obviously after they took me off, I was still in the hospital for a while. It was a rough recovery period. I was in a lot of surgical pain. I was having a lot of throat pain from all the tubes. My nose was hurting from having the feeding tube. There was tubes in places that, you know, you just never imagined there being a tube being put, or that you just truly never, like, I've never imagined having to write a will and at 23 years old, or telling my mom how I'd like my funeral or who I'd want there, how I'd like it. And the night before, which I've been through a lot. And so the night before that October 22nd surgery this past year, we actually sat down and I read her everything. And it wasn't easy because, you know, who wants to hear their kid's obituary or, you know, their wishes at that age. And then the next morning I never woke up and she saw me in an ICU intubated. So again, I think everything happens for a reason, and that was just a part of the story. And I'm here to tell you about it. So.
Yes, you are. Yes, you are, Tina. You are here to tell us, and you're going to continue to tell us. We're going to have you back on the show, and just think. And I love what you said about the flyer. You took a chance, right? You responded, and you never know what can happen from just taking an opportunity. And this is what this show is all about: is to encourage people to send that email, to go to that audition, to go for that degree, whatever, to start that business, whatever it is, but take the next step and don't let anything stop. Yes, stop you from taking the next step.
I was told by, I mean, again, this could be saved for another broadcast, but I was obviously in an environment where there was an abusive alcoholic, and I was told that I was never going to make it as a nurse. There was no reason to go to college. I was stupid. I was dumb. It was never going to happen. There was no reason for it. I didn't need to work. I didn't need any of that. And I did it for myself. I did it because nobody can ever take it away from me. It's mine. And I did it because I want to change the lives of others. And I did it ultimately to show that person that their word meant nothing to me. It wasn't going to stop me, and it wasn't going to belittle me. And I'm proud of my choice and my decision, and I'm proud of my work and my work ethic, and what I turned out to be at such a young age, and all the opportunities, accomplishments, advancements, and chances that I've had.
Listen, everybody, if you have a school, university, high school, middle, whatever, if you have a group, you need to invite. You do take invitations, right?
Yes. I would be honored to come and speak to the class, grade level, and share my story a little bit more in depth, and hopefully inspire them or reach out to them in a way that their peers might not be able to understand, because that was a struggle I had growing up. You know, I didn't know who to talk to or what to say. I was afraid. You know, a lot of other kids would talk about having both parents in the household, and I didn't have both parents in the household. You know, at that age, people, if you don't live with an alcoholic or aren't being abused, you don't really know the signs. So it was very difficult, and I would love that opportunity to be able to share that with other students and be able to just show them I still turned out better than how I was treated. And that's what I want to show others, that your circumstances are not going to define you unless you let them.
Listen, everybody, this is Tina MIANO, and please connect. How can they connect with you, Tina?
So I'm on Facebook. Yeah. My name is Kris space capital TINA. It's just separated. It's Christina. And on Instagram, I'm at Tina with a second A. So it's TINAA dot MIANOO. My picture on both social media platforms is the same. It's this picture that you can see here. So friend me, connect with me. You can follow my health journey, my life achievements, and even life setbacks, because I openly share that publicly. And I'd love to have you along for the ride. Awesome. Give us your Facebook name one more time. It's capital KRIS space capital TINA. Everybody, please connect with Tina. You will not be. Or they could go to your page and find me there and click follow. Yes. Listen, everybody, you are going to be seeing a lot of Tina on my page, on my Instagram, everywhere. Yes, because she's just that amazing. And I can't say enough of how honored I am to and grateful that you responded to the flyer. I'm appreciative of all your work and everything you've done and included me in, and for this opportunity as well to share my story. Absolutely. So we're going to definitely have you back, Tina. And is there more you want to share with us before we let you go? I mean, I have a lot to share, but I think we're going to have to save a lot of it for another time. But I would share a few other points regarding my education. while I was away at school, I was also the program tutor for the nursing program. So I just hope that goes to show other people who might have been homeschooled or might have had a different education before going into college, that you still have the opportunity and the chance to be a good student. Even though your situation was a little bit different and you weren't in the school, it's still very possible to academically achieve. And obviously with being on the dean's list and being asked to be the program tutor for all classes in the nursing program, I think that was a true honor. And again, just goes to show other people that regardless of the education that I might have received that was different from outside of the classroom and inside of my living room, I was still able to be successful I was at a private institution at a top nursing school in the nation. So I was very thankful for that opportunity and chance. And again, I really do attribute it to my determination and strength. And then the other point that I would share is regarding like the pain that I feel daily. I also go through a lot of nausea and vomiting and dizziness and heart rate issues. So a lot of people don't see it. And I think that's the problem. I mean, now that I'm bald, people look at me a certain way and think and assume that I have cancer or that I'm sick. Because my other symptoms weren't necessarily visible. I didn't have a limp with all of my hip surgeries. I didn't have any visible things on my body for people to make it like, oh, she is sick. And so I got that a lot, like, oh, well, you don't look sick, or she's not sick. She doesn't have, she doesn't have this, or so a lot of my symptoms are invisible. And so actually on that point, I'll just share briefly. One time I walked into a wall and just passed out. And then the person realized that like, oh, she really is sick. So I have something called vasovagal syncope, and I just pass out when my blood pressure drops or my heart rate drops. And so I think there needs to be a more defined awareness regarding invisible and chronic conditions that don't always look visible. But now that I'm bald, I get questions a lot. I actually get a lot of comments. And while I knew that I was going to struggle with people accepting me, I also never imagined some of the hurtful comments that I've received, like you could shine a tire with your head, or if I gave you a comb, you'd have to part with it. But I've also never thought that I would receive so much love, support, and encouragement from my family and friends. And if it wasn't for them, I don't know how I would have gotten through it, because it certainly wasn't easy. And so I'm thankful for my family and friends who have continued to let me be a part of things, who have not viewed me any differently, and who have continued to love me just the way I am. So my only goal is that if you have somebody in your life who may be going through something or maybe different than anybody else, that you continue to include them, because I can assure you that it means a lot to them.
Yeah, thank you. I can't even begin to. We could probably talk for another hour and a half, 2 hours, 3 hours.
We sure can.
The whole afternoon, but I can't say enough of how grateful I am of you, of how blessed I am because of you and being a part of our life and our journey. And so thank you for that. And I appreciate you, your mom as well, but I appreciate you so much, more than you would ever know. But I thank you. No, absolutely. You are truly inspirational. You give hope. You give life. I mean, do you know that, and I'm sure you have to know, right? The power of you.
I'm not sure that I know the power of me. I just hope that when the good Lord calls me home, I've touched some lives down here. And I hope that I've even inspired just one person to continue in any aspect that they may be struggling. I hope that I've taught somebody something in regarding anything that I talk about or share. And I just truly hope that people know that they're loved, and that I'll always be there for anybody. And so if I've done just that, and for one person, it's been all worth it. But considering you just said it, it's my mission's complete.
Oh, listen, I was going to say, you've done it with me.
Thank you.
You've done it with me. Absolutely. And so I thank you so much. Is there anything else you want to share on this broadcast before we go? Because I'm bringing you back. Thank you. Because
I think I just would want to tell everybody to make sure that they continue to fight. They continue to ask for their chance, and they always believe. I have a tattoo that says that I have miles to go, because that's just how I believe in life. It's just another view on, you refuse to sink or you refuse to give up. And everybody has miles to go. So when you reach a roadblock, it's really not the end of the road. And I think I hope I've showed that throughout my life challenges, that it's really not the end. Time and time again, I have proved people wrong. And I've also proved science wrong. So I'm very proud of myself and hope that I can just share my story with others and show them that anything is possible if you believe.
Leave it there, everybody. That says it all. It's possible if you believe. Thank you so much, Tina. Thank you so much. Me. Please give us again, if you want to donate to Kris's Kaps, again, to help others struggling with hair loss to still feel confident, or just in any part. Yes.
Reach out to me on either platform, Instagram, direct messaging, or Facebook IM. We could coordinate how to get it to me. If you're local, I could pick it up. We could mail it. We can figure all that out, the specifics. But yes, anything that you may have that's on the list, I'd be happy to collect and donate to a facility in need with patients that will greatly appreciate it. It means a lot for them to know that they're being thought of by the outside community and by those who still have hair. And it means a lot to them to know that there's people who support them.
And one more time, if you could just share again, I believe you called it donate. If people want to donate their tissues and their organs.
So that's something called Donate Life. In some states, it might be called Donate Life. And in some states, it's called organ donation and tissue donation. It depends on the state that you live in. But you can just call or look up on Google Gift of Life or Donate Life. Or you could just go right on the DMV website for your state, and there should be like a big, bold, sectioned area that says sign up to save a life today. And I just really want to make it super clear, because I know there's a big stigma behind it, that people think that if they're in a car accident or something tragic and they look at your license, they're not going to do any medically saving treatment. And as a nurse and as somebody in the profession and as a recipient and a nurse who works with people who have received and donated, I can assure you that it does not mean that you will not receive medical treatment or any less of a medical intervention than anybody else. It just means that when it's your time, that they will take your organs and tissues and pass on whatever is viable to somebody else in need. And so you can save, one person can save 8 lives via organs and 75 via tissues and ligaments. And I'm living proof of that by 2. So I truly would not be walking on my own today if it wasn't for the 2 in the sky. And while those donors' families wish to remain anonymous, I will loudly and proudly make their voices known through tissue and organ donation advocation. So it's been a true honor to be a recipient and to work on both ends of it. Being a recipient and watching my own patients when life was ended and they had to give the gift. It's been a pleasure. It's been hard, but it's truly come full circle. And I never thought in my life I would have to say to anybody that I'm a double tissue transplant recipient or that I've ever received a gift of life. But I just think, again, it was part of the story, and it's been one of the most inspiring things and one of the hardest things I've ever been through, because emotionally I wanted to get to know them. And I'll briefly sum it up. I want to know the silly things. Do they like chocolate ice cream, or do they like vanilla? Do they like soda, or, what did they like? I want to find a way to honor them. And unfortunately, when I tried to connect with both families, and I totally am okay with their wanting to be anonymous, and I respect that. But I do feel that the only way I can honor them is to continue to advocate. And as a nurse as well, it's just part of my duty to advocate. So my way of honoring the 2 angels in the sky is continuing to talk about it.
You are doing just that. Thank you, Tina MIANO. Thank you so much. We're so proud of you. I can't wait to have you back. I want to have you back like as often as I can, because your story and your journey is so inspiring, and so many people need to continue to hear this. You are giving life. You at this moment, this hour, you have given life, because so many have heard you that will watch this show and just be so inspired to not give up and to believe.
Thank
you, Tina, so much. I look forward to our next time coming together, which I think it's going to be very shortly. So thank you again so much.
I thank you for the opportunity and the chance to share my story. And I hope if anyone took anything out of this, they ask for their chance.
I'll leave it there. Listen, Tina MIANO, listen, everybody, let's give thank you so much, Tina. You're an amazing inspiration. We so applaud you. And listen, everybody, you know what our motto is. Dream, take that step, and walk with purpose into your destiny. This is Inspiration with Troy Alexander. We come back next Monday night, 7 p.m. Eastern Standard Time, right here on Facebook Live. Thank you, Tina. Have a great night, and I'll see you soon. Thank you, everybody. Have a good night.
Bye.
Bye-bye.